Guys, and welcome back to my channel. I'm in the UK right now and my appointment's in London. As you can tell by the title, I'm getting a liquid BBL. I'm staying at my friend's house right now, so she lives in like this cottage thing and I keep whacking my head on this. I'm gonna put like sunscreen on because I have to catch the train in 1 hour and I haven't even eaten yet. But I'm traveling into London to see Dr Ducu. I don't know if you've heard of him before, but my friend has been to him. It's basically like hyaluronic acid, like a filler, a body filler, like what you get in your lips, but it's a body filler, so it's thicker. I will be showing you what my bum looks like right now because I'm not getting the liquid BBL today. I'm actually getting it dissolved because I've had it done before, not by this doctor, by someone else. If you don't know, pretty much everyone can inject in London. It's not as strict as Australia. So anyway, I went to this kind of like shady kind of place. I paid like 10k and I got like over a litre injected in my bum, and the results were really good. But I noticed like after 1 month I got migration. That's all getting dissolved, and then in like a week I'm gonna go back to him and he's gonna like refill it. So I'm gonna take you guys along with me for the whole process. I am vlogging everything for TikTok, but obviously I can't go in as much detail as I can on YouTube, so I'll show you. I'm gonna come here because of the lighting. So now I have hips, which is great. All of this is fake. This is all the filler. And I don't know if you can see from the front, where you can definitely see when I turn around, but this is the migrated side, so it comes out. Okay, let me take the pants off. So you can see I have a lump here and I have this bubble here, and where I'm getting the line, oh, you can see it, like this looks bad. Okay, so can you see when I like flex? I don't even care about cellulite because that means it's fat. I have scars here, don't worry. That's from when I fell off a roof when I was on a farm, so don't mind that. But can you see this line here, this shadow? That's basically where everything migrated. That's the pocket. So that is the big issue that I'm getting dissolved. Guys, I barely made the train. Like, I just made it in time. I don't know why I do this to myself. I forgot to mention, with the filler that I've gotten and the complications that I had last year, sometimes I can feel the filler and I don't think that's really normal, but then it is a foreign thing in your body. So maybe it's like breast implants. Like, I don't have breast implants, so I don't really know, but maybe sometimes you're reminded that it's there, and it's not painful, but it's uncomfortable. All of this is probably not good for you, so don't do it. Hey guys, I'm here. I made it off the subway. I was really scared. It's really hot in there as well, but this is who I'm seeing, Dr Ducu. I'm really nervous. Also, I know I said I'm not excited for the pain. I'm also not excited for how much this is going to cost. I will tell you guys at the end because I'm getting it dissolved and I don't know how much I'm getting put in, so I don't really know.
So the way it's going to go today is we're going to use an ultrasound, see wherever the filler is, remove as much as we can out of it. We'll leave the filler that's sitting nicely and doesn't affect us. Okay. Superficial lumps, superficial granulomas, I'm going to remove. Deep ones, if they don't bother you and we don't see them, we just feel them a bit, we're going to leave them alone. Okay. Okay. But again, if I see on ultrasound that most of the filler is superficial, I have to remove all of it. Why? You already have migration, the rest will migrate. It's a large quantity, so most of it will migrate. Okay, so I can see this here and feel it.
That is.
Okay, can I touch your bum?
Yes.
Okay. Besides filler, have you had any other procedures? Have you had the lipo BBL?
Yeah, BBL.
When did you have it?
Probably 2022.
Okay.
And then I did the second one 6 months later.
Can you tense your muscles for me as much as you can? All right, so you already started having granuloma lumps, but they are deep. Okay. So I don't recommend we take them out now. Okay. We melt what we need to melt, but even from the projection, it has moved here. Granuloma, granuloma. Okay, go like this. Can you activate the clarius? This is what we're melting. I need to melt a bit here as well. All right? After I take care of this, we're gonna take care of the rest, okay?
Do you feel that?
No, I can't feel it at all. You can just push it out now.
Yep. You can even see it coming out. If you want to see it. This is the filler.
Yeah.
Okay? Because it becomes liquid. most of our procedure will go. We're just going to push the filler out. It's easier than And when I can't push it anymore, I'm just gonna literally suck the rest out.
How you feeling?
It's just like I'm getting a massage. You know how it was starting to change my, like this, the colouring of the skin in that area?
It will go back to normal.
That's so good.
This is a big lump of filler. You can see it right here. You see the filler?
Yeah, that's crazy.
Just come to my clinic.
I'm all done, I'm leaving. Honestly, didn't even really hurt. Okay, so to put it in perspective, it hurt less than getting lip filler. So I'm back home. I have to wear this compression garment. I don't know if you can see. I have to wear it for 3 days and then I'm gonna go see him. I also had to take antibiotics like every 8 hours. I have to keep on top of that. But we ended up only doing my right side. I'm gonna do my best to explain this. My body has encapsulated around it, which means that the filler is stuck there. It's not going to migrate, whereas this side was just migrating, like migrating down my leg. This one, it's stuck there, and it's more dangerous to dissolve it because then it'll open up little channels. Just leave it and your body's just naturally going to dissolve it over time. So this side didn't get touched at all, just this side. And hopefully next week when I go in and see him, he can re-inject it and everything's going to be fine. Can't believe I went to like a chop shop. When I showed him videos of it, he was like, no, like how did you not get sepsis? He said they weren't even doctors. He's like, the way that they're operating, he's like, that's not what you're supposed to do. They don't know what they're doing. She had her hair down.
Depends on your own body. So I'm just putting my hand here to block it so it's not going any higher.
He said that's where your regularity came from, the color changing, it cutting off your blood circulation, because it was all put superficially. You're not supposed to have all that redness. Last time, the place I went, I had to take like 2 months off. It was like BBL recovery. It hurt so bad, my ass was leaking. There was so many complications. But with him, he's like, no, it's a smaller needle. Your body will heal over that hole within 3 days. You go explore London. You're here to travel, go have fun. There's no downtime. Don't lay in bed. Don't, just go out, live your life. Just don't get the bandages wet and just wear the compression garment. So this doctor is really good, really professional. He really knows what he's talking about and no pain. I'm so fortunate. The place that I went last year and I didn't get sick. I really did that to myself. Why? So it's already been a week, which is absolutely crazy. My ass is healed great. Today I'm gonna go get it all filled up, and I also decided that I'm gonna do everything that I wanted to do all in this trip instead of coming back later, because I'm already gonna be in pain. I was just like, I'm just gonna do everything. So I'm getting my skin tightened on my stomach because you guys know that I got a BBL, and mostly everyone that has liposuction gets loose skin. So Dr. Ducu actually trademarked this procedure, so I'm getting it done on my stomach. It's not a surgery, it's just like a bunch of needles, but it is invasive because it's a bunch of needles going in and burning. It's kind of like, I don't know, in the way that they kind of explained it reminded me of J-plasma, but I know it's not that, it's combined treatments. But I also am doing it on my face here, just to tighten this little bit. I was going to get filler, but honestly, I don't really want to add to my face. So instead, we're just going to like tighten, which I think is going to help these lines here. And what else am I doing? A little bit of lip filler because I had it all dissolved last year. There's a lot of the stuff I can't do in Australia, so I'm just like gonna do it all here. So I will be vlogging that as well, and I'm probably gonna be in a garment for my stomach and probably for my face. Yeah, that's everything. I'm gonna show you what my ass kind of looks like now. I hope that that is level, but I'm just wearing this whatever outfit because I want to be comfortable and I don't care about this getting stained. But I don't know if you can really tell, but this is what I got dissolved right here. So from the front, so this area. I will show you without the pants as well, so you can see. Okay, so this is what we're looking like. So yeah, it looks a lot better than it did the other day. I still have the band-aid marks on it, but the holes are completely healed. If you can kind of see in here, but like I said, it was safer just to leave it than dissolve that one. And I haven't had any problems on this side, so yeah. And it definitely jiggles a bit more because it's like a deflated balloon. I'm going to quickly show you the loose skin. I would like to help the skin that hangs over my belly button. So we're just going to tighten it a bit.
So we're going to do this, which is basically round it up, okay? Right, and then we're going to do this. I'm just gonna add a bit here because here you have and here you don't. Okay, so it's gonna be round and natural looking. Okay, and if we go here, looks better from the back and from the front as well. Okay, makes your waist smaller. Map everything.
It just feels like pressure. You can feel the pressure. Basically, yeah.
No pain
Not really. I think it's the idea of it that's scary.
from 1 to 10.
3. Yeah.
Really? Can I say hi? This is realistically the maximum you can go. You have more swelling here, so this will go down.
Yep.
This, if you look, if we made it bigger, it wouldn't fit with your thighs.
Yeah.
And even your waist wouldn't look that good.
Okay.
Even if you do this, it will look very strange.
Okay.
Now, projection-wise, if you turn around, projection, yes, you have the space to go bigger.
Okay.
Probably do this.
Yeah.
That would be the maximum, but the way you have to think about it, the distance from here to here has to be roughly the same distance as from here to here, roughly.
Right.
So you can go a bit bigger.
Okay.
That's the perfect candidate for skin tight, which is basically we're using a combination of Morpheus 8, body tight. We stay away from the ribs with the body tight, but not with the Morpheus 8. Morpheus 8 is actually gonna go up to here. So our entry point is gonna be here. Okay. And if you look here, you can't really grab the skin. Okay, so you don't need it here.
This is what my stomach looks like. That's it. Very painful. It's a little bit embarrassing, but oh well. Hi guys. Okay, I know the camera's in a really shitty spot, but I can't get it any better. It's the next day after doing everything. As you can see, my face is really swollen. I did sleep on my stomach, so that doesn't help with the swelling. But I just took everything off because I have to spray it all. I'll show you what I have to use. But this is what my body looks like after the skin tightening procedure and Morpheus 8. But yeah, honestly, the Morpheus 8 was the most painful thing I've almost ever done. Okay, my first nose job was like #1. That was terrible, that one. Because he like shaved my bone or something. I don't know what that doctor did, but it came out botched anyway, so. But speaking of BBL, I feel like I've had a BBL. Like that's kind of the overall feeling. I feel breathless. And my tummy is like tight and my bum is like full to the max. I can sleep on my back, which I did for some of the night, but it obviously is like uncomfortable because my bum just got injected, so sleeping is really hard. But yeah, that's what my face looks like. It's really, really tight and swollen. But yeah, overall, like I feel pretty good. I'm gonna go outside, even though I have to wear like my compression thing. So this is the spray I have to use on my face and my stomach. So she said close my eyes. And I have to do this every couple of hours. I'm also gonna do my stomach, but yeah, I'm gonna go outside and I'm gonna go down to a cafe and I have an assessment to finish. I have 2 days and I haven't even started it, so I need to go do that and probably eat something because it's not good if I don't eat. Today's the day I get to take off all the bandages from it. It's 3 days. Okay. And then your stomach.
Lovely patient Vanessa here. So we've done full body tightening of the abdomen and flanks, plus 500 cc of filler on each side on the bum. A week before that, we did removal of migrated filler on the bum, don't mind turning around. Her healing is super fast. As you can see, this is the entry points from removing the filler. This is the entry points from adding the filler. They're almost completely healed, and this is just since Thursday, so we're on day 4. If you don't mind turning around on the other side. Same thing on this side. We didn't need to remove any filler. She's almost completely healed. If you don't mind turning around on the back. So I'm very happy with the symmetry. I'm very happy with the result. She is as well. We might need to do a small touch up on the hips, but we'll find out in a week's time. When it comes to the tummy, she has healed super fast. Normally, I ask my patients to wear compression garment for a week. She doesn't need it. She was already having results. Her skin is a lot tighter than it was to be. As you can see, her abdomen is flat. You can't really notice any fibrosis. You see the markings from the Morpheus 8, and that's it. Now, we've also tightened the skin on the face. For some reason, her face tends to swell more. So we're 4 days post tightening the skin on the face. You have to take into consideration that this is very similar result that you get, for example, with a superficial face and neck lift. So obviously the recovery is still going to be a bit faster, but she will still need to wear the compression garment a bit more. What we're also going to do is give her some prednisone to speed up the process of the swelling so she can enjoy her summer. Another good news is today is going to be your last day of antibiotics. I don't need you to take any more. Okay? So I'm very happy with the healing process, and I hope you are as well.
I'm very happy.
And exactly the same.
Already bruising. It's been 3 months, which is perfect because I wanted to give it enough time to settle, because the last thing I want to do is tell you guys to go do something or give you my thoughts on something without giving it long enough. My thoughts on Dr. Ducu, amazing. I already know I'm going to go back to get a touch up. I will show you what my bum looks like now because it dropped, because it looks pretty crazy. I've been editing this video and it does look crazy when you first get it done, because like a BBL, it has to start high. If you put it low, then you think after it fluffs, think a boob job, after it fluffs, it drops. Same thing with the BBL, same thing with this. So it has dropped. It's soft now, it's squishy, it feels like fat. I love the size of it. I love the shape. It's a love heart, which is everything that I wanted, even from when I first got BBL. That's what I asked for. So the filler really gave me everything I wanted. I just wish it was permanent. It's not. So it only lasts 2 to 5 years, depending how much you get. The more you get on it, like lip filler, the longer it's gonna stay. So I'll probably get a top up every few years. I do want to add a little bit more on the small side. Do you remember how I told you my left side was a little bit smaller? So I'll probably go back next year for a little top up, and then after that it'll just be maintenance. It is very expensive. I want to talk about the cost now. I did the skin tightening as well on my face and my stomach, which this is how it's looking. I did recently, about a month ago, get a bit of filler put in here because I still had pretty deep lines. The filler, I think, smoothed out my face. I don't know if I see much of a difference with the skin tightening. I do have a checkup with the doctor, so he's going to tell me if I need to do another round of Morpheus, especially on my stomach. I know I have to do 2 more Morpheus 8 treatments on my stomach, and he gave me a good doctor here in Sydney to go to because I really don't trust a lot of doctors in Australia. I don't think they're that good, but he recommended one in Sydney, so I'm going to go see her. I think it's a woman. But yeah, the price of what I paid, somewhere around 30,000. I think it's definitely worth it. You obviously don't need filler, so you need to be able to have enough money or make enough money to upkeep it. Otherwise, you're going to spend all that money at the price of a BBL and then it's going to go away. So you have to weigh up all your options. But like I said, for someone that like doesn't want implants or can't have a BBL or something like that, filler is perfect. It's just not permanent. It's not painful at all, especially if you go to Dr. Ducu. Don't go to a chop shop like I did the first time because it was really painful and I had problems. So, oh, that also included me dissolving the filler, that price. So when you factor in everything that I did dissolving, I did a whole new liter of filler, and then I did the skin tightening and Morpheus 8 on my stomach and face. Then it's a fair bit, and I did get a little bit of lip filler, which I recorded as well. So I did do a fair bit for the 30,000. Cosmetic surgery in general is not necessary. You do not need it to be beautiful, and it is all optional. So that's, I think, everything. If you have any questions, leave them in the comments, but I'm going to finish this video with showing you what I look like right now. I think this dress actually that I'm wearing really shows off my figure so nicely. So I'll show you with the dress on, and then I'll also show you without the dress so you can really see, and I'll turn around and everything. So yeah. Because I just finished recording what I look like. One, it's never going to be perfect. Your body is naturally asymmetrical, and from the beginning I said that my left side was always smaller and my right side had a problem with migration. I do think it has moved a little bit, and you'll see it's a little bit pointy in one area. That's just what the touch-ups are for, and to even it out. It will never be perfect, and I don't expect it to be perfect, but that is why I'm going for a touch-up, just to even out everything. You can't expect it to be amazing after getting so much in. They don't know how you're going to heal, how it's going to stretch. So that's why you go back for a touch-up, to put in all the little small details, finishing details. So I just want to say that quickly, because I think in the video you can see it doesn't look that symmetrical, but you have to remember real life is very different to online. Like, I feel like I look very different on camera to how I look online. Everyone tells me that too. Now let's see what I look like. If you liked this video, please give it a like and subscribe to my channel. Bye guys.